Hello, this is Dr. David Greene, CEO of the Mid-Atlantic Pain Network. Today's topic, what are the available knee injections for arthritis? Knee arthritis affects over 40 million Americans, and it's the leading cause of disability in the U.S. More women than men suffer from arthritis by about 20%. The total cost for arthritis in this country exceeds $100 billion a year. Between 2000 and 2010, the number of knee replacements in the U.S. doubled. Almost 600,000 knee replacements are performed each year in America, and that demand could go up by a ton, up to 3.5 million a year by 2030. Interestingly, 35% of those who receive a knee replacement are between the ages of 50 and 69. So it's a total quality of life procedure. It's elective. It should only be performed after considerable conservative treatment, such as anti-inflammatories, Tylenol, short-term prescription pain medications, topical patches or pain creams, physical therapy, bracing. Now, moving into knee injections, there are several different types. There's tried and true, gold standard cortisone injections, which have been around for decades, hyaluronic acid, and then the regenerative medicine, which includes PRP and then stem cell therapy. So looking at cortisone injections, since the 1950s, so over 60 years, they've been a mainstay of knee arthritis treatment. Initially, they were performed for rheumatoid arthritis, and then a few decades later they spanned over into osteoarthritis. As most know, they don't cure anything. They're basically just pain relievers, and it's questionable if they harm cartilage. There's been quite a few studies looking at that. In small animals, yeah, they harm the cartilage. In larger animals, it was not shown that they harm cartilage, and it hasn't really been looked at too much in humans outside of the lab. Studies show that 3/4 receive good to excellent results. The pain relief can last for months at a time. They've turned into the gold standard for knee arthritis. Hyaluronic acid injections have been FDA approved for over 15 years now. Hyaluronic acid, it's the motor oil that's normally found in the synovial fluid of joints. So we have it naturally. What was approved by the FDA is not natural Synvis. It comes from rooster combs. The whole type of injection is called viscosupplementation. There's quite a few companies out there providing these injection materials: Synvisc, Hyalgan, Orthovisc, and others. None of these has shown superiority to the other. Okay, in one of the largest U.S. studies to date, it was shown to be beneficial effects in 80% of patients for over 6 months. So they can be highly effective, and the theory is that they provide additional lubrication, anti-inflammation, and they can compel your knee to make potentially more cartilage. So looking at PRP therapy, this is platelet-rich plasma therapy is what it stands for. It involves a simple blood draw from the arm, and that blood is 30 to 60 cc's is then placed into test tubes and in a centrifuge where about 12 minutes of spinning concentrates the platelets and the growth factors into one of the layers that results. So then that layer material is put into the painful knee, and there have been several studies looking at this. A large one showed 70% good to excellent results at 6 months, and one out of Hospital for Special Surgery showed preservation of cartilage in over 70% at 1 year. This is with just one injection. Stem cell injections have the potential to alter the course of arthritis and not just to mask pain. There are 3 different types: bone marrow-derived stem cell injections, where the bone marrow comes from your own hip area; fat-derived stem cell injections, where it's your own fat; and then amniotic-derived, which is somebody else's amniotic fluid processed at an FDA-regulated lab. All 3 of these are being shown to be extremely effective. These are mesenchymal stem cells. They're not embryonic. There is no fetal sacrifice or anything like that, and they're not embryonic, so there's no ethical concerns. So looking at knee cartilage defects, one study showed that 6 months after transplantation of the bone marrow, the patient's clinical symptoms had improved, and the improvements had been made over the follow-up periods up to 2.5 years. There have been no large clinical studies yet in humans, but there's been lots of small ones. The bottom line is there are various types of knee injections available. All of them are low risk, outpatient. In combination with other treatments available, they may help delay or even avoid the need for a knee replacement, and all can be repeated every 3 to 6 months as needed. The Mid-Atlantic Pain Network offers the top non-operative pain management in the whole Mid-Atlantic region. There are many clinics in the network, accepting over 50 insurances and providing over 25 treatment options with the board-certified award-winning doctors. Visit us online today at midatlanticpainnetwork.com and then call us for more information and scheduling at 855-444-6585. I'm Dr. David Greene with the Mid-Atlantic Pain Network. Your pain stops here.